So as we know is that in previous era time, the patient contact is more and the paper writing is also more and more that lethargic and it was taking time a lethargic. So nowadays the everything is on our hand. So as our Narayan Murthy sir in previous Infosys director said that effective use of technology is important to deliver healthcare. By leveraging technology, you can bring down lack of access and cost of healthcare. As we all know, in COVID era time, we learned so many things. We use so many devices while dealing with the patient with the patient of COVID. And nowadays, this is the fashion, and now this is the necessity of each and every healthcare worker and also general public. So nurses are at the front line of healthcare, often being the first point of contact to provide patient with the care required. And like any other role in the healthcare profession, they are often time crunched and have a myriad of tasks. It means they are doing so many works in large number or countless to accomplish on the ground. So what is the new? So what we are saying that technology practices to deliver better patient care. In that, the technology plays an important role in healthcare services. As we all know, the future of nursing lies in the working hand in hand with technology, and nurses must embrace emerging healthcare technology to stay relevant in the coming years. Technology and humans hand in hand for a better healthcare. So, what's new? Any guess? Yes, Pooja? इको हो रहा है Sorry for this. So, any guess? So we used to see in the our COVID era, as all of you know, the nurses they are showing the record and reports on the devices. Okay, so what's new? Any guess? If anybody is saying something, so now the era is the telehealth nursing. Telehealth nursing is essentially what patients have come to know in the past as counseling over the phone. However, technology today allows telehealth nursing to reach patients, monitor their conditions, and interact with them using computers, audiovisual aids, accessories, and telephones. So remote patient monitoring, how we are doing the remote patient monitoring. So this is very important by video calling. If the patient is in the this in the Ladakh or we are so by telephonic or by video conferencing, we will take all the details of the patient, whether patient is getting the treatment proper or not, while he's taking the follow up or not. So by remoting the patient monitoring, in that replace, in that what we are doing, we are taking all the details. So this is the subcategory of home health care. As we know, we are dealing with the in the telehealth medicine that allows patient to use mobile medical devices and technology to gather patient generated health data and send it to the healthcare professionals. So, there are few examples of RPM. By video conferencing, by telephonic contact, we can see the glucose meter for patient with diabetes, heart rate or blood pressure of monitoring, continuous surveillance monitoring that can locate patient with conditions like dementia and alert healthcare professionals of event like a fall. So what is the what the caloric intake or diet logging program? So that can be, we can easily remote patient monitoring by doing the video conferencing or telephonic. So now the era is the electronic health records. As we know, there are so many health related apps. Means while we are using the fitness app, everything is there: heart rate, how many steps we did, how many calories we burned. So likewise, in electronic health records, this is the mode that replacing older paper filing methods, as we know, allows nursing expert to document care provided to patient and retrieve information that can help prioritize the care. So in this electronic health record, the patient does not need carry the so many files. So nowadays everything is on tap. We can easily put the UHID number and we can access all the details of the patient. While we are using the MedMantra app or Wipro app for this. So and there are so many numerous kid health app is also there for tracking this electronic health records of the patient. So information entered into the computer system can be accessed by the care team, by a nurse, including doctors, even patients themselves, when it's necessary. Can tell registered nurse whether there are further steps they need to take for a patient, monitor small condition changes, and give them information immediately as alerts or reminders. While security continues to be concerned for EHR, HIPAA laws, HIPAA means Health Insurance Portability Accountability Act, and privacy of electronic record are maintained uh, by a healthcare organization. And new technologies like blockchain and cryptography are easing privacy concerns. Yes, we are nowadays we are using this blockchain methods and cryptography also. In blockchain method, we are sharing that immutable ladders that facilitate the process of recording transactions and tracking assets in the business network. Means we are taking all the records into the business network. We are keeping all the records. In cryptography, is a technique to secure information and communication through use of codes, so that only those people for whom the information is intended and understand it can and it process it. And HIPAA is aimed at protecting the personal data of patient from public access. The Indian government are working to enact the personal data protecting bill along with the proposal like Digital Information Security in Healthcare Act, DISHA. As we all know, India's HIPAA equivalent could enforce the implementation of enhanced data security solution. So,
Excuse me, sir. So your voice is not coming.
my voice is not coming, madam. Wait. Now my voice is coming. Am I audible?
Yes, sir. Now it's better.
So what is the benefit? In that we improve the patient care, increase patient participation, improve care coordination, improved diagnostics and patient outcomes, practice efficiency and cost savings. So what is the need? As we know, nurses are on home, students are also home nowadays. We are keeping our data also up to date, and we are also keeping our patients' data. So what's new? As you know, we are using with our smart beds. So in
Sir, your sound is not audible.
Now it is audible. It is audible.
Very low,
Yeah.
sir. Audible, but very low, sir. Please increase the device.
Already increased.
Now, yes, sir. Now, yes. Now we can hear you, but previously it was not.
Okay, sir. Okay. Thank you.
So nowadays we are using the smart beds in that nurses track the movement, weight, and even vitals. The smart bed also play a major role in keeping patients safe and comfortable during a long hospital stay. With the number of falls and patient injuries inside hospitals, smart beds are very important for the patient safety. In patient safety, as per international patient safety goals, these falls are very decreasing day by day when we are using these smart beds. So, so smart bed technology give nurses a constant in room monitor that provide them with regular updates and communication on a patient activities. It can also help them identify patterns which can lead to a new diagnosis or a different understanding of a condition. Nurses also spend less time coming in and adjusting supplies and medical equipment for comfort or safety because they can help control with their smart bed. By using the computer at the nurses station, it allows provider to get back to other important work that only humans can do. So next is the smart IV pumps. As we all know aware about these smart IV pumps, we can easily control the doses and drips given to the patient. Software and medical tech allow nurses to change the drip amount and medications thus so patients are not waiting for the changes. IV pumps for nutrition that gives needed meals at the right time. Self pump that allow patient to increase a controlled amount of pain medication for themselves. Automated IV pumps help speed up nursing process and can be crucial if there is a need to immediate adjustment. Changing medication through an automated process also removes elements of human error that could present issues for clinical patients and hospitals. Automated IV kits give nurses to while they are using this to focus on the other area of work instead of having pressure and give the medication or food. Hospital, all the hospitals have different kinds of automated IV pumps. So training and education is often based on the specific hospital where nurses or healthcare workers they are working there. So now a portable monitoring we are using allow nurses professionals to check on patient if they are on the move or busy helping someone else. Device monitor vital signs like ECG, respiratory rate, O2 saturation, heart rate, the information back to a central monitor. So it can help to the nurses as well as also a patient also. This means that nurses will get an alarm notification if there is an emergency there. Most hospitals have nurses check the levels hourly, allow nurses to track and note states at the right time, even if there are lot of other things going on.
So your voice is not audible.
Madam, my voice is audible. Now is it audible?
Yes, sir. Uh, yes, sir. Now it's better, but very low.
The volume is very high. Now audible?
Yes, sir. Now better.
So most constantly monitor patients from anywhere in the hospital. Alerts and alarms sent to nurses through the portable monitors can save the patient's life. Next is the wearable device. As we are wearing the nowadays wearing all that, and that heart rate is there, so we can easily access our heart rate, respiratory rate. We can easily access. So at mobile app are transforming the healthcare industry. Devices that can track heart rates, exercise, sleep, respiration, and more are helping people take their health into their own hands. And these very wearable devices are often called the future of healthcare. Access to huge amount of data, device can help the entire healthcare process from diagnosis to recovery. Helps remove elements of human error for nurses because the communication of data comes directly from the device itself only. Allow for faster record keeping and help patient and nurses maintain constant monitoring of the health. Now the next is the improving administration, operation and inventory management by app or by using the technology. So the nowadays RFID we are using in that case Internet of Things IoT application can be great help in making this space for more connected, secure, efficient to bring in more transparency and better management. So while we are using the RFID, as we all know, our aware about the RFID radio frequency identification tags and barcodes, for example, for using for patient in and out are now being placed extensively for medical inventory management. We are using for this the in pharmacy management system. We are using this type of RFID system. So these tags are placed on medical equipment, or while we are dealing with this biomedical equipment, they are placing these tags and where it come and where it will go, that will easily this identify the RFID. And also we can track the supplies by the hospital staff efficiently and effortlessly track their location, status and usage. IoT smart devices like the smart mobile, medical sensor, fitness tracer being used to make the hospital environment more efficient. These sensor devices in refrigerators, freezers, laboratories ensure that the blood samples, vaccines, and important medicines are stored at the right temperature and dispensed correctly to the save time and improve the patient care. So we can also by we are using this RFID, we can also locate real-time location system used in conjunction with IoT can mark inventory and manage medical equipment employing location-wise sensors. These systems can send out alerts about incorrect device use, contamination medicine, or stock expiry dates. The smart sensor network can also make hospital admissions and operations more efficient and streamlined. IoT application can be employed for contactless registration of patient tracking, patient information, and guiding patient across the hospital environment. Few other technology practices which are leveraging to deliver better patient care, like as you know, artificial intelligence and robotics. Potential to redesign healthcare completely. AI algorithm can mine medical reports, design treatment plans, or create drugs way faster than any current actor on the healthcare palette, including any medical process. We are using the drone also for this pharmacy supplies or medicine supplies by using this type of artificial intelligence, and we can easily get the data by the virtually also, and we can use to treat and manage to wide range of psychological illness by virtually means video conferencing and conditions from stress and anxiety, dementia by talking on the video call. Patient is able to step into a panoramic view of their body. We can easily see by the video conferencing. And next is the augmented reality. In that, AR augmented reality differs from the VR, means video conferencing reality in two aspects. User do not lose touch with the reality and it puts information into the eyesight as fast as the possible. And nowadays we are using this telehealth is a valuable never element in health newer element in healthcare. Hospitals and clinics allow patients to virtually video chat with a nurse to describe their symptoms or show doctors things like races or bumps. These help patients with a quick diagnosis without leaving the comfort of their own home. They can find out if they need to come in further testing or diagnosis. Get a prescription for medication is easy in that, or get advice is also easy in that. When we are using next, how it technology helps to improve patient care and their experience. So, number one is the reduce medical errors, time saving, remote patient monitoring, accessibility to virtual care, improve lines of communication, increase the collaboration among the physicians. It means reduce medical errors by prescribing errors can harm the patient receiving from the caregiver. Medical errors we can easily send by this. Clinical facts also we can easily send by this, and medication reminder can assist medical professional when choosing the drugs in safe in the future. Enhance the drug safety. Doctors are fully responsible for ensuring their patient, what the patient is receiving the drugs, whether they in the correct drug doses or ensuring medicine would not be correct. Using electronic system can enhance the safety of prescribing drugs, which naturally improve the patient care. When patient information is stored in cloud-based solutions, it becomes much easier for prescribers to understand which medications will treat their conditions or disease. And in remote patient monitoring can provide positive outcomes to help patients manage these chronic illnesses such as heart failure, stroke, COPD, asthma, hypertension, and so many. By implementing patient data management system (PDMS), healthcare providers can remotely monitor patient's condition and interpret gather the data to decide on the correct medical approach need for the treatment. So in that accessibility to virtual care is more important. Improve lines of the communication, whether it is the doctor to doctor or doctor to nurse, doctor to pharmacist, nurse to pharmacist. Patient portal helps to improve to engagement that which can determine the success of the outcomes. So this type of activities improve the lines of the communication. So in that increase the collaboration among the physician is the more important. Patient care is improved when physicians work together. For example, virtual conferences come in handy if doctors are in different time zones. If suppose we are in the Maharashtra region, suppose somebody in the J&K region, we can easily access both patient and the doctors. So it can increase the collaboration among the physician as well as nurses and the patient also. Whether it is an older adult with a cancer diagnosis or a child with the common cold, medical providers consider the quality of care they deliver a top priority is more important. Each patient deserves top tier treatment no matter the physical or mental challenges they have been facing. So while patient care is a top priority, digital healthcare can also positively impact the rising health cost many people worldwide facing. So now, how latest technology improve you to experience and feel better in patient care? As you know, this is the less discomfort, less pain, fast recovery, helps to take second opinion in a fraction of seconds and pop-ups for you for the follow-up or the treatment. And this is, as we know, technology is the less time consuming. So this is from my side. This is my topic. If any doubt is there, you can ask me.
Thank you, sir. Thank you so much for this session. If anyone have any doubt, you can ask. Anyone have any question? So we have some questions in the chat box that please share the PPT. Thank you, sir, for the nice PPT, and please share the PPT and the recordings.
Okay, definitely I will share with you.
Okay, sir. Okay, thank you so much. And so, one more thing, one question from my side, like we are talking about the technology and how we can improve the patient care and their experience for these things. So it's a little question like now we are talking about the robotic things, robotic science, and many of our surgeries is nowadays converted to a robotic surgery. So how successful these things to like we are handling if being a healthcare professional, we are dealing with the human beings, life. So how successful is this to hand over these life again to the machines?
No, madam, both the machine and human touch is more important in both sides, madam. Because in robotics, what all the if the patient is going for surgery and this robots they are doing the surgery, first we have to feed all the data. After that, robots will continue. So after that, this robotic surgery or robotic treatment, we have to provide the human touch also. So nowadays, in robotic surgery, main important role is the madam artificial intelligence, as we know. So,
Right.
so we have to first feed the data. Means what surgery, what time we that robotic the robots will conduct, so that we can first easy and accessible amount should be fed into the robot so that they can easily do the surgery in a successful way.
Okay. Okay. Thank you, sir. Thank you so much. Again, if anyone have any questions, you can raise. So I think most of the things were related to the PPT and the content and
I will share
the recordings. Thank you, sir. Thank you so much. And thank you all for joining the session. Thank you, sir.